You know how sometimes you're in a relationship or just thinking about why you react the way you do, and it feels like there's this hidden script playing out. Like something learned way back when is still kind of calling the shots.
Hmm. Absolutely. It's
Yeah.
like we all have this fundamental, um, deeply ingrained pattern for how we connect or, struggle to connect with others.
Yeah.
A kind of relationship blueprint that starts forming from our very first moment.
Exactly. And understanding that blueprint, especially when it's leading to, well, frustration or pain, can be incredibly powerful. It's a way to unlock insights into ourselves and why things play out the way they do, but maybe more importantly, how we might be able to change things.
That hidden blueprint and what happens when it gets a little tangled up, let's say,
Mhm.
is exactly what we're diving into today. We're taking a deep look at what's called adult attachment disturbances.
Okay. And our sources for this deep dive sound really rich. You were saying we've got material that digs into the science behind how these patterns form.
Yep, the science, how we can actually spot them in adults, and perhaps most importantly, how it's possible to repair them. It's definitely a clinical perspective, but one packed with practical understanding and I think a lot of hope.
Think of it as getting a shortcut, maybe, to understanding the why behind some of the most challenging relationship dynamics and seeing that change isn't just, a nice idea, it's something specific practices can actually aim for.
That's the goal. So our mission today is to unpack this fascinating material for you, pulling out the key concepts and some really surprising findings about how those early experiences echo through our adult lives. And of course, highlighting that pathways to repair are not only possible, but they're becoming, well, clearer thanks to this kind of research.
Okay, let's unpack this.
So the journey really begins with the pioneering work of John Bowlby, right? He didn't just see babies clinging to parents as like cute or dependent. He saw it as a fundamental instinctual human drive. It's this delicate dance between two core needs, the need to seek closeness and safety near a caregiver.
Right, the safe haven idea.
Exactly. And the need to explore the world, knowing that secure base is there to return to.
That balance sounds absolutely key. Mary Ainsworth's famous strange situation experiments really showed how a caregiver's consistency and availability shapes this, didn't they?
They really did. When an infant has a sensitive, responsive caregiver, they learn, okay, this person is a reliable, secure base. They feel safe enough to explore, but know they can go back for comfort if they get distressed or scared.
Right. They get that inner confidence. My person is reliable. I can venture out and, see what's out there.
But if the caregiver is inconsistent or rejecting or even frightening, that confidence just doesn't develop properly. And the attachment system finds different, sort of less optimal ways to cope.
And these early coping patterns, which Ainsworth saw in infants, secure, avoidant, ambivalent, resistant, and disorganized, they don't just disappear, right? They evolve.
Exactly. They evolve into distinct states of mind about attachment in adulthood.
And the sources highlight four main adult prototypes, you said. Secure, which is that healthy base we hope for.
Right. Then the three insecure ones. Dismissing, which kind of maps onto the infant avoidance style.
Okay.
Anxious preoccupied, which comes from the infant ambivalent resistant.
It.
And disorganized, which is linked to that infant disorganized pattern.
And underpinning all of this is a really crucial concept, internal working models, or IWMs.
Yes. These are like our internal maps or scripts for relationships built from our entire relational history. They're the unconscious rules we follow about, whether we're worthy of love, whether others are generally reliable, what to expect when we try to connect.
It's like the brain creating a best guess based on those early experiences.
Precisely. And if those experiences were confusing or painful, the mind might develop what's called defensive exclusion.
Yeah.
It's kind of like blocking out information that doesn't fit the defensive pattern it built to survive.
Ah, good.
And this can leave you with fragmented or contradictory internal maps, especially in the insecure styles. The systems for seeking comfort or exploring might get, shut down or go into overdrive.
Which can leave you feeling stuck, right? Running these old scripts, even when they're clearly not working in your adult life.
Exactly. So let's maybe look at what these insecure patterns actually look like in the adult landscape. What are some of the telltale signs of these different styles playing out?
Okay. Let's start with a dismissing style.
All right. So dismissing individuals tend to downplay the importance of close relationships or their need for others. They might seem fiercely independent, maybe uncomfortable with emotional expression or vulnerability, either in themselves or others.
So they might emphasize self-reliance to an extreme, almost denying they need anyone.
Yeah, very much so. And the sources mentioned they can, interestingly, Underevaluate how similar they are to others, maybe projecting their own uncomfortable feelings onto other people to keep them at a distance.
Yes, like a defensive projection you mentioned.
Right. And what's fascinating is that even when they've had difficult past experiences, they often report less distress about relationships than other types. This seems linked to that emotional cutoff or suppression. It's like they've built a wall around their vulnerable feelings.
So you often won't see them in therapy unless something really big forces them there.
Pretty much. Or if they do come, they might talk about their problems very intellectually, very detached.
It reminds me of how Hazen and Shaver described avoidant lovers having a fear of intimacy, but also not seeming overly worried about being abandoned.
Exactly that stance. I don't need you anyway, so I can't be hurt if you leave.
Yeah.
That kind of vibe.
Okay. Then you have the anxious preoccupied style, which sounds like almost the opposite energy.
It really is. These are people who might desperately crave closeness, but they're constantly worried about abandonment. They tend to be highly sensitive to any sign, real or perceived, of potential rejection or neglect.
They're almost always on high alert in relationships then, needing lots of reassurance, maybe overthinking everything, often feeling rejected even when it wasn't the intention.
Yes, precisely. They can't really turn off those painful emotions easily.
Hmm.
They might exaggerate negative emotions or distress sometimes. They may be trying to get a response. They're constantly seeking reassurance, but sometimes struggle to really internalize it or believe it.
Right.
They might share too much too soon with people, but then struggle to respond empathetically to their partner's vulnerability because they're so caught up in their own anxiety.
It's that hyperactivating strategy you mentioned, constantly trying to pull others close to alleviate the fear.
Exactly. Always trying to close the gap, reduce the perceived threat.
Okay. And finally, the disorganized style. You said this one is often the most complex clinically.
It often is, yeah. These individuals don't really have one clear strategy like the others. They might swing back and forth between seeking closeness and pushing people away, sometimes even seeming to do both at the same time. It's confusing for them and for others.
The sources described it as having very dysregulated internal states emotionally and even physically sometimes.
Yes, there can be confusion about themselves, a feeling of having different disconnected parts. It's hard for them to feel a solid sense of self or pursue goals consistently.
And relationships can be very volatile, like that phrase stable instability.
That captures it well.
Yeah.
Things feel constantly unpredictable, and this pattern is often linked to those really difficult early experiences where the caregiver was maybe frightening, perhaps abusive, or seemed frightened themselves.
Ah. So when the person who is supposed to be your source of safety is also a source of fear.
It creates a fundamental fear without solution. There's just no clear path to safety when the threat is your haven. It's a terrible bind.
Yeah, it makes so much sense that navigating life with such a contradictory internal landscape would lead to significant challenges, like uh, difficulties regulating emotions and developing a stable sense of self.
Absolutely. The sources point out how the anxious, preoccupied style can involve weaker self-development because they're so focused on trying to manage the caregiver's needs or moods. And tragically, in more severe cases like psychosis, there can be a profound lack of self-development.
And this brings us to the really significant, sometimes surprising, links between these insecure attachment patterns and broader psychological distress, even specific psychiatric conditions.
Yes, the sources make it very clear. Insecure attachment isn't just a relationship problem. It's broadly correlated with emotional distress and a whole range of psychiatric symptoms. It impacts your whole system.
Right. And the research shows, for instance, that anxious insecurity often seems more strongly linked to overall symptoms and negative emotions than the dismissing style is.
That's generally true. But specific patterns do seem to line up more frequently with specific issues. The dismissing style, for example, is linked more often to personality disorders characterized by emotional distance, like avoidant, paranoid, and schizoid personality disorder.
Okay. And the anxious preoccupied style.
That shows up more with patterns like histrionic, borderline, and dependent personality disorders. Those often characterized by intense emotions and significant relationship struggles.
And the disorganized pattern, you mentioned it's sometimes called fearful attachment in self-report measures.
Right. It's also linked to avoidant personality disorder, interestingly, but it's particularly overrepresented in forensic populations, like individuals who are incarcerated. It tends to be associated with a wider range of personality disorder symptoms overall, including more aggressive or self-defeating traits.
And the link to borderline personality disorder, BPD, you said, is one of the most specific and robust.
Yes, especially with unresolved or disorganized attachment. Studies consistently show higher rates of abuse or neglect in the histories of people with BPD. Also, lower capacity to understand their own and others' minds, what we call reflective function, and difficulty making sense of past traumas or losses.
Wow. What about other areas?
Well, eating disorders are another area with a very high rate of insecure attachment. The sources cite up to 90%.
90%. That's huge.
It is, and interestingly, a large portion are actually the dismissing type, around 47%, often linked to histories of parental rejection or neglect, and maybe a lack of coherent memory about their past relationships.
That's fascinating. Any other conditions?
Even things like factitious disorders or malingering, where people might unconsciously or consciously fabricate symptoms, are linked to insecure attachment and often histories of chronic childhood illness. It's almost as if the medical system inadvertently provided a kind of attention that met unmet attachment needs, leading to this patterned way of seeking care.
That's quite a perspective.
And then there's a really strong connection to dissociative disorders, conditions where people might feel disconnected from themselves, their memories, or reality. The sources really emphasize this is linked to insecure attachment, especially disorganized, and it's made worse by later abuse.
Okay, and this is where we get to that really crucial insight you mentioned earlier from studies like the Orphanage Study and the Minnesota Longitudinal Study.
Exactly. They suggest that the main root cause, the etiology of what's often labeled complex trauma, is actually disorganized attachment, rather than trauma per se.
So, wait, trauma can obviously aggravate it terribly, but the core issue, the vulnerability, stems from the disorganized way the attachment system developed because of that early frightening or unpredictable caregiving.
That's what the evidence strongly suggests, and it has big implications. For example, some standard trauma therapies that focus only on processing the traumatic event without addressing the underlying disorganized attachment pattern can actually make things worse for people who have that pattern compounded by later abuse.
Wow. So you're saying the way the brain learned to handle closeness and safety in infancy because of the relationship with the caregiver is a more fundamental predictor of these complex later difficulties than just the traumatic event itself. That really reframes things.
It absolutely does. It highlights the profound and sometimes underestimated impact of those early relational experiences on brain development and psychological organization.
Which makes understanding the underlying pattern vital in any kind of clinical work.
Precisely. And that brings us neatly to assessment. How do clinicians actually figure out what someone's adult attachment pattern is? The sources point out there's a big difference between interview-based methods and the self-report questionnaires most people might encounter online.
Right. Self-report tools like the ECR, they ask you how you think you feel or behave in relationships, right?
Exactly. Whereas interview-based methods, like the gold standard adult attachment interview or AAI, are different. They ask you open-ended questions about your childhood relationship experiences. But the clinician isn't just listening to what you say, the content, but how you say it. Your coherence, the way you narrate your experiences.
And the sources emphasize that the AAI is preferred for clinical depth because it can access deeper, less conscious patterns.
Yes, exactly. Because it asks you to retrieve and talk about potentially difficult memories in real time, it's harder for your usual defenses to completely mask your underlying state of mind. It kind of surprises the unconscious, revealing your actual state of mind with respect to attachment, not just your conscious opinion about yourself.
It's like it bypasses the front door defenses and looks at the wiring behind the walls in a way.
Yeah.
By paying attention to things like contradictions or odd hesitations or getting lost in the narrative.
hmm The interviewer can see the underlying organizational pattern: secure, dismissing, preoccupied, or unresolved disorganized.
So while self-reports put people into categories based on their conscious answers, the interview reveals the underlying mental processes, which sounds much more useful clinically, especially for complex cases.
Yeah, definitely. The sources also mention the Metacognition Assessment Scale, the MAS, as another tool. It helps zero in on specific difficulties in understanding your own and others' minds, which become key treatment targets.
Okay, and that leads us perfectly into the good news part of this deep dive. Pathways towards repair.
Yes. The sources frame treatment as aiming to actively heal these attachment disturbances and help individuals achieve something really powerful called earned secure status.
Earned secure, meaning you can actually become securely attached despite having had an insecure history.
That's exactly it. It's profound proof that change is possible, that your past doesn't have to dictate your future relational patterns.
That's incredibly hopeful. So how does that happen?
Well, a core idea across many therapeutic approaches is the therapist serving as a secure base. The therapy relationship itself becomes a new, reliable experience of connection, different from the past.
Okay.
Key processes often involve helping you build a clear, coherent story of your life, integrating the difficult parts instead of avoiding them. And working through challenges or misunderstandings that inevitably happen in the therapy relationship becomes a chance to repair ruptures in real time, learning a new way.
And gradually letting go of those old defensive patterns to internalize a new, more secure way of relating.
Precisely. The sources touch on different models that facilitate this, like the DMM approach, which focuses on identifying and freeing up those old survival strategies so you can use them more flexibly, or schema therapy, which uses things like imagery and reparenting techniques to help you build a healthy adult part of yourself.
Right. And others like AEDP, which intensely focuses on the healing power of the here and now emotional connection with the therapist.
hmm Or intersubjectivity models, which look very closely at the tiny, moment-by-moment exchanges that build connection and mutual understanding.
But the authors of the core material we're looking at propose a specific, comprehensive approach they call the three pillars.
Yes. Assessment, metacognitive interventions, and comprehensive repair methods. They see these pillars working together synergistically.
So once you understand the pattern through assessment,
You work on building the capacity to understand minds, your own, and others through metacognitive interventions.
and then you use specific techniques for deeper healing in the comprehensive repair phase. Okay, so let's dive into those second and third pillars. Metacognition first, understanding minds. What does that actually look like in therapy?
So, metacognition, or sometimes called mentalization or reflective function, it's simply the capacity to understand mental states, your own thoughts, feelings, intentions, beliefs, and those of other people. It's about seeing behind the behavior to the mental state driving it.
And the sources argue that building this capacity is vital because it promotes collaborativeness, that ability to connect and work together effectively with others.
Yes. And the idea is that insecure attachment can involve a kind of developmental arrest in this area. The capacity didn't fully develop because of the early environment.
So how does a therapist help you build this?
It can be quite direct, gently pointing out patterns you might be unaware of. I notice you tend to look away when we talk about difficult feelings, or when you speak very quickly without pausing. It makes it a bit hard for me to follow your train of thought. It's about raising awareness of how your internal state is impacting the interaction, right here, right now.
It also sounds like it could involve explicitly learning some skills for healthy communication that maybe weren't modeled or even possible in your childhood.
Absolutely. And the MAS assessment helps pinpoint exactly where the difficulty lies. Maybe you struggle to identify your own feelings accurately, or maybe you have trouble imagining what someone else might be thinking or feeling.
Is there a specific technique mentioned?
One mentioned, particularly for the anxious, preoccupied style, is marking effect.
Marking effect.
Yeah. So if the patient is talking about a difficult event, but maybe glossing over the feeling, the therapist might gently say something like, "Wow, you must have felt incredibly scared in that moment." It helps the patient connect with and name their own internal feeling, shifting them from constantly trying to figure out what others are feeling, that outside-in focus, to recognizing and validating their own inner experience, an inside-out orientation.
Ah, that makes sense. Shifting the focus inward.
Exactly. And even simple things like using anchoring scales, asking, on a scale of 1 to 10, how connected do you feel to what you're saying right now? Or how organized does your thinking feel? Can help someone become more aware of their internal state in the moment, especially helpful for disorganized states.
Okay. Now moving to that third pillar, comprehensive repair. The sources highlight imagery techniques as particularly powerful, especially something called the ideal parent figures or IPF protocol.
Yes, this is where it gets really interesting and, for many, quite transformative. The goal of IPF is basically to help the patient create a stable, felt sense of receiving perfectly attuned, safe, encouraging caregiving internally. The therapist guides you in vividly imagining parents or parental figures who embody exactly the qualities you needed but perhaps didn't consistently get.
So you actually imagine feeling absolutely safe and secure with these figures, seen and accepted for exactly who you are.
And genuinely encouraged by them to explore your world and your inner self. You imagine feeling capable and competent because you have this unwavering, perfect, reliable support system inside you.
Wow. And you said the way this imagery is done is tailored specifically to the person's insecure style to directly address their core wound.
Exactly. It's not one size fits all.
So how would it work for, say, the dismissing person? The one who avoids closeness and vulnerability.
For them, the imagery often focuses on exploring the self within a relationship context, something they usually avoid. The imagined ideal parents would respect their need for space, but also gently notice and encourage the expression of underlying feelings, the hurt, the disappointment, the need that they've walled off for so long. It helps them practice tolerating closeness while feeling vulnerable, maybe even letting them control the imagined distance initially to make it feel safe enough to start letting the walls down. It transforms that approach avoidance conflict around vulnerability.
Okay. And for the anxious, preoccupied person, the one constantly worried about abandonment and focused on others.
For them, the imagery strongly focuses on validating their own state of mind, fostering that inside-out orientation we talked about. The ideal parents are imagined as consistently available and knowing exactly how to soothe their anxiety. But crucially, these IPF don't pull the child into their own worries or needs. They provide containment without enmeshment.
Ah, the positive opposite of what they might have experienced.
Precisely. And the imagery strongly supports the child's independent exploration and unique self-development, giving them the felt sense of having the courage to be their unique self, separate from needing to constantly monitor or please the parent.
That sounds incredibly powerful. What about for the disorganized person with that painful approach of avoidance, conflict, and fragmentation?
For disorganization, the imagery is carefully designed to transform that core conflict into a feeling of conflict-free, secure connection. The ideal parents are imagined as being able to attune to and handle the full range of emotion, including the frightening or confusing parts without becoming frightening themselves. The source even mentions using imagery of other supportive figures, like maybe a wise man or a compassionate guide, who can gently approach the dismissing parts or devil parts, those aspects of the self that are terrified of connection and trust, approaching them in their isolation with understanding and compassion, offering a safe haven for even the most defended, scared parts.
That's quite profound. Are there other imagery techniques used?
Yes, the sources mention others too, like imagining your best self, feeling capable, effective, competent, and bringing those qualities into challenging situations. Or specific self-agency imagery, exploring feelings of capability. And self-esteem imagery, which focuses on linking positive feelings directly to your internal sense of self, maybe imagining a lightness of being.
And then, building on this internal sense of earned security, the sources also talk about promoting secure intimacy in adult life.
Right, helping patients develop a clear vision for what healthy adult romantic relationships look like and feel like, maybe incorporating some of those qualities of the imagined ideal parents into their idea of a secure partner, exploring past and future caring behaviors too.
Okay, so the big question, does this actually work? You mentioned the authors conducted a pilot study using this three pillars model.
They did, and the results reported were quite remarkable. All the patients in their pilot study who had various insecure styles, mostly complex and disorganized cases, achieved earned secure status by the end of treatment.
All of them.
According to the report, yes. They showed high coherence in their narratives on the AAI and significant increases in metacognitive capacity on the MAS.
Wow. Now, what makes that finding particularly compelling, you said, was the comparison to a control group.
Yes, and this is highlighted in the material as really significant. They compare their outcomes to a control group who had received extensive mindfulness training. Now, that mindfulness group did show benefits. They increased their reflective capacity, showed some improvement in mental organization, but none of them reached secure attachment status on the AAI.
Ah, that's a critical difference.
It really is. It strongly suggests that while building reflective skills like mindfulness is valuable and important, something specific about the ideal parent figure's imagery,
Ah.
that process of actively creating a felt sense of ideal caregiving within yourself, seems to be a potentially necessary ingredient for that deep, transformative remapping of the attachment system, for truly achieving earned security.
It points to the profound need for that relational connection, perhaps, and the brain's incredible capacity to heal and change when that need is finally met, even if initially through these internal imagery experiences guided by a therapist.
It certainly seems to point in that direction.
So there you have it. We've taken quite a deep dive into the world of adult attachment patterns, how they form, how they can show up in some really surprising ways in psychological distress, impacting conditions like BPD and dissociative disorders.
And we've explored these innovative pathways towards repair, grounded in careful assessment, building that crucial capacity to understand minds, and using powerful techniques like the ideal parent figure's imagery, all with the goal of achieving earned, secure attachment.
The core message really does seem to be one of profound hope. Understanding these patterns isn't just about labeling problems, it's really about seeing the pathway forward.
Absolutely. Healing seems possible, and building more secure, authentic connections with yourself and with others is genuinely achievable. The possibility of changing that fundamental blueprint is incredibly empowering.
So, maybe a final thought to leave everyone with. If earning secure attachment relies, at least in part, on creating this internal felt sense of receiving ideal caregiving experiences, what does that tell us about the enduring human need for connection?
Yeah. And maybe about the brain's extraordinary capacity for change and repair, even decades later.
How might thinking about ideal connection, even in this initially imagined way, reframe how we understand our past, maybe our present struggles, and the very real potential for a different kind of future?